there, and welcome to another episode of the Power of United Impact podcast. I'm Michelle Tucker, President and CEO here at United Way of Greater St. Louis, and I am sitting down with a friend of mine who I haven't seen in a little while, Melinda Monroe, who is the Chief Executive Officer at Nurses for Newborns. Now, I want people to learn a little bit more about you and then a whole lot about Nurses for Newborns. But let me just say, when I say we are reconnecting today, you and I, many years ago, were in a program together, Leadership St. Louis with Focus. And so I wanted to acknowledge that and say that to everyone listening out there that we were the best class ever, right? Back in 09-10.
We were.
Yes, we were. So spent lots of time together back then, and just happy to see you sitting here and having this discussion to help to raise the awareness around Nurses for Newborns. Now, before we get started and go any further, I want to remind people to follow us on social channels and to catch our podcast on their favorite podcast channel. Wherever you catch your favorite podcast, tune in to us there. And you can also catch us on Facebook and on YouTube. So let's dive right in. Why don't we start by telling people what originally brought you into the field that you're in and what's kept you passionate over the years?
Sure, Michelle, thank you. So it goes way back to when I was about 11 or 12. And I volunteered in a summer camp, a day camp for children with developmental disabilities in my hometown. And I was assigned to the preschoolers. So these were all children under 5 who were attending day camp, many for the first time. And we had a little girl who was 4. And at the beginning of the camp, she was crawling as a 4-year-old. And her parents were told that she would never walk. And I watched her take her first steps to her mom in front of us. And between the excitement of that and also the joy on her mother's face, yes, I was like totally hooked to witness that. So then I went on to raise my 2 sons, who were both born prematurely. My youngest son was 2 pounds when he was born, and watching their development, and they've grown into fine young men. And it is so powerful to begin services early and to get that help early. And my own family is the beneficiaries of that. So I have dedicated my career to this work.
Wow. So it's a personal experience, personal passion for that.
Absolutely.
And you've got some good stories to just compel people to want to lean in and hear more about what Nurses for Newborns is out there doing. And why don't you tell us more about Nurses for Newborn?
Yeah, well, we aim for health, safety, and wellness for babies and their families, moms in particular. And we're trying to set the best possible foundation in that first year of life. Mm-hmm. And when you set the trajectory of health in the right direction in that first year of life, you can have a very, very long impact with it. So we start during pregnancy, if possible. About 50% of our families come to us before the baby's born. And we provide home visits to families who are struggling in some way. And it could be that the baby was born early. It could be that mom's got a health condition. It could be that they are isolated. They don't have any family here. They don't have any help, a whole variety of reasons. Or that they're just requesting help. They feel overwhelmed. Yeah. And all the services are free, thanks to our supporters, including the United Way. And we have a model that we've developed here in Missouri and replicated in Tennessee. Okay. That's customized for our communities. And we send highly skilled registered nurses, community health workers, and licensed clinical social workers into the home. So we go to them. There is a whole series of screening, assessments, teaching, including every family learns how to resuscitate their own baby. And every year we have at least one family who does. They learned how to clear a choking airway in an infant, breastfeeding support, how to soothe the crying baby, how to tell if a baby's sick or just sleepy. Right. All the things that there's no manual that comes with the baby. And so really empowering families to have that kind of knowledge base, and so that they can act in the baby's best interest. So we weigh the baby at every visit because that is one of the best indicators we have of health in the first few months of life. Okay. And then, of course, lots of resources.
Wow. It's so important, though. Just in those early days, you talk about, just like first-time moms, and there's no manual that comes along with having a baby.
Right.
Oh, gosh. So important what you're doing. Let's talk about prevention, though. And we talked about prematurity and, the things that Nurses for Newborns is focused on. Let's dive more into the prevention side and what you believe prevention-based care does to help.
Well, it's core. It's core to my personal beliefs. It's core to the beliefs of our organization and really anyone who works with us, including our entire board. But getting ahead of problems,
Right.
Basically getting out in front of them and making sure that families have the knowledge and resources that they can use to impact their child's future, and they're in particular around health and safety. We have known for years that the return on investment, there's a financial return to this.
Okay.
Of this kind of early support is on the order of 1 to 4. So every dollar spent brings the community back, saves the community $4 in fixing problems that could have been avoided or addressing things that could have been avoided. However, when funding is scarce, resources tend to go to addressing emergencies, or they tend to go to putting out the fire that's in front of us, and it's only natural. We have to do that. So we have been very fortunate to have the support of the United Way, because that is a part of saying to us, our community believes in prevention, and here we are.
Well, happy to partner with you and focus on, like you said, prevention. And then, sometimes there are just the urgent situations. And so we want to be there to support those as well.
Mm-hmm.
What are some of the most common challenges families face that your team gets involved in?
Well, bringing a newborn home is overwhelming.
Yeah.
Very overwhelming and exhausting. And if you layer on financial worries, a hospital stay, lost employment, maybe the baby had some health problems, maybe mom's got health problems, you layer all that on, and the overwhelm can go to crush. And so we help families prioritize and arm them with knowledge and tips. But some of the common challenges that we see are just managing infant care, figuring out about crying and sleeping and feeding. It's all the basic things that babies do. We see a lot of maternal depression and anxiety. We actually screen for that at multiple points during the time that we serve families. And we're picking up between 30 and 40% of our moms in St. Louis region are needing some kind of support around mental health. And so it's a real concern. Also, functioning in the healthcare system. Our nurses are great, and our community health workers are great at helping moms and dads negotiate the healthcare system.
Okay.
Which can be kind of challenging and confusing sometimes.
Confusing, yes.
It's confusing. And then there's this whole intersection of scarcities: housing, transportation, food, childcare. And the reality is, especially when a family has their first baby, the reality of that all kind of piling up on them at the same time, including how expensive it all is. How often do we hear, I had no idea diapers cost this much. I had no idea formula cost this much. And just managing all that and having someone to kind of be at your side and help you redirect maybe to something that's less expensive or spread the knowledge around. So those are some really common things that you see.
Well, I like that you're talking about a support circle almost.
Yes.
And, we all need support at different points in life. And, having a first child is probably one of the scariest times for someone who just, you just haven't done it before.
Yeah, right.
So everything that you're talking about is that hand-holding and at least being a resource at the ready if someone needs to call and reach out or ask questions that they might think, this is a crazy question to have to ask, but you make it safe for them to just simply ask and get the support and response that they need. So it's a really good thing that you're doing.
We're relationship based.
Yes.
So one of the most important things that our home visitors do is establish a relationship with
Right.
the family.
Relationship is so important.
Help them feel comfortable asking questions. Help them feel comfortable letting us in their home. I mean, that is a huge privilege to cross the threshold into somebody's home.
Yes.
And we don't not take that for granted. And our staff work hard to establish that relationship as right at the beginning.
Yes.
And has to be maintained, and we have to earn their trust. So fortunately, nurses as a profession are one of the most trusted professions around, and that helps. But it's still kind of scary if you have someone coming into your house and you're afraid you're going to be judged, or
Yes. Yeah.
that it's not going to be a positive experience. And so we know that nothing will happen in terms of the outcomes that we're all looking for if we can't establish that relationship.
I agree. When you said it best, it's that relationship building, but it's all around trust.
Trust.
Right? It's trust to let someone into sort of that inner circle and to be the sort of resource that you are, which is incredible. And I want to talk more about just how we partner to help the community. And so let's switch the focus just a bit, but let's talk more about your partnership with United Way and how it is helping you to scale your mission.
Yeah, well, what we need fluctuates from year to year.
Right.
And one of the really wonderful things about the United Way model is that we are allowed to point our allocation to where it is needed. And that has been really helpful. We've been United Way involved since 1998.
Oh, wow.
And so it's been
So long.
right.
Relationship.
But that consistency and flexibility is everything. It's really everything for us. And in addition, the United Way has helped us expand geographically. We've added some counties over the years. I remember very specifically when back in the days, we used to do supplemental allocations, and we went in and we said, we need to serve Warren County.
Right.
And our United Way team was like, we need you to serve Warren County.
Let's do it.
Let's do it. And so we're still serving Warren County. And so that kind of ability to take our work and expand within the footprint of the United Way has been really helpful.
Well, it's good to know. And I imagine you just follow the data. You know where you are needed, and you know when you need to expand. And so we are happy to have been there as a partner to help you to expand in that way. Your services, they cover everything from medical assessments, mental health support, essentials, and then things like diapers and car seats. And so you just run the whole spectrum, the whole gamut, right? Yeah. How do partnerships like the one with us, and we'll stay on United Way, how do we help to ensure that families are receiving the support across all of these areas?
Well, one of them is it's impossible for us to meet all of the needs that families have during this period. It's impossible to meet all the needs that are presented to us. And the rich array of organizations that are supported together as a safety net.
Yeah.
We know each other. We know what each other does. If someone's got a new program, we make sure we know about it. And that really helps us expand the reach of what we can get accomplished and what we can help families with. We also are a big fan of 211.
Okay.
And use it all the time.
We're a fan too. I'm just like,
thank you for that. And to be able to put some of that resource development into the hands of the family and show them how to use it. And then when we're gone someday, they will know, and that will be with them. So that's been a huge help. The United Way also is really good about, over the years, we've had phone calls saying, we just got a truckload of diapers that got delivered to us. Can you use some? And our answer is yes. We go through thousands and thousands of diapers a year. So you share the wealth, and the generosity of the community comes back to us, and it's very heartwarming. When we moved our office in 2020, and we notified the United Way that we had extra furniture, and so then we've received extra furniture from other United Way agencies, and it seems like a silly little thing, but it's not. That's expensive.
It is.
And for us to be able to get something for free means it frees up funds for our families.
Yes. So I also like that you've talked about how you work with other United Way partners to service your clients and the families that you help, because you always say that one agency can't manage everything alone, and if you've got trusted partners, back to trusted partners that you can engage and bring into sort of that trusted circle to help the family, then I think that certainly expresses the power of United Impact, right? We do that. And so I'm glad that you brought forward that example. So we've talked about a lot of things already, and I want to talk about things outside of the funding that helps, right, from us to you. And you talked about like diapers and donations. You mentioned you participated in the Olin Board Fellowship Program. You said that to me right before we got started. Can you tell us what benefits you get from the Olin program?
Yeah, we actually did two different things with Olin. So if I could talk about both of them, I'm excited about both of them.
Okay.
The first one was our board fellows. We had a board fellow 3 years.
Yeah.
And it really infused some energy into the board to have. They were all younger folks who were in the midst of getting their MBAs, and to bring them in and get their ideas was it really did infuse energy. We also, the first year we had the woman who was assigned to us was really interested in data, and she helped us build a board dashboard, which we had not had.
Okay. Dashboard
At that point, and she automated it. We were just wowed. it was literally click and ship kind of dashboard, and we still use versions of that today, even though it's been a while. So that was really helpful. It also, our board really liked being in the mentorship role.
Good.
And it gave them additional purpose to think that they were preparing somebody to serve another board someday.
Yes.
Whatever community they land in, even if it's not St. Louis, take that with them. And they really owned that. The other Olin partnership, United Way partnership that we participated in is I went through their nonprofit leadership certificate program at the Olin School. And the United Way paid for part of my tuition to do that and invested in me.
Of course.
And that was 12 years ago. And so 12 years I have used that information. It was really a good program and something that I'm very proud to have been a part of. So you don't think about those kinds of things when you think about United Way, but investing in the infrastructure and the knowledge base of how we treat our nonprofit community, I think, is a beautiful thing.
Well, leadership matters. And strengthening the organization, it starts with leadership. And so we know that it matters, and we are going to continue to invest in like capacity building of leaders and others across the company. And so happy to do that. Happy to partner with you in that way as well. Let's talk a bit about a couple more things, and then I think we're going to have to wrap. We're going to be out of time.
It goes fast.
I can talk to you forever. But let's talk about the home visiting program. What's that, and how does it work?
Well, that's our core program, and we support families from pregnancy through age 2. So it's not just newborns. So when we serve a family, we will work with them to find out what their goals are, and then that helps us set how long we need to be there. And that's all worked out between the home visitor and the family, but we go to them. So it's really a opportunity to have services without the barrier of transportation for our families, and to have someone who's knowledgeable about infancy in your home to ask the questions that you want to know about your baby. We do have one specialty program that we run that can extend to age 3. So if we have families who need the extra support, we can do that. And then we coordinate with other organizations after that to make sure that they've got some place to have support afterwards.
The next step. Yeah, because it's a journey.
Yeah,
it's a journey.
Exactly.
Tell me about the Enriched Assistance Program.
Well, that is wrap around to our core home visiting, and which is led by nurses. But we also have community health workers who serve in peer roles with our moms, and represent communities of color and communities who may be foreign-born. We make sure that we are working within the cultural respect. And so that has been a really important addition for us. And we can actually serve families in different languages now directly without using outside translators, which has really been helpful. But we also have our counseling program, and we grew that over the years because we were really struggling to find enough with that kind of screening rate that I mentioned before, enough providers to serve the moms who have the expertise of that perinatal period.
Okay.
And so we have it in-house for some of our families. We still refer out a lot, but that is another part of the wraparound. And then we offer car seats, pack and play cribs.
Yeah.
We have a safe sleep program to make sure families know how to put their baby down to sleep safely and they have somewhere to do it. Diapers, formula. We have a warehouse of baby clothes. And all of that is gifted to us from the community for the most part. And we have a whole cadre of volunteers. I should mention that we're also a United Way volunteer center. And so
Yes.
we have volunteers that come in literally every day and help us recycle baby items that would have gone in the landfill. And we get them refurbished and out to families who need them. So that's another part of what we do.
I never want to undervalue or underestimate the power of volunteers.
We couldn't function without them.
That's what I keep saying. It's like we need our volunteers. And so hoping that people continue to visit stlvolunteer.org to sign up. And I know you are continuously posting opportunities for people to get involved. And so let's keep doing that because we got to mobilize people where we need them. You all do a lot of data collection. And I referenced that earlier, but let's talk more about that and some of the outcomes you've established through your data collection.
Yeah, our founder invested in electronic records very early, like in the 90s.
Oh, wow.
When folks weren't doing that. And so we have a lot of information and data which we guard and cherish, but it also helps us not only evaluate our program, but to look to the future of what we might need to be doing differently.
Yeah.
Use it for quality improvement. So a few examples of our outcomes, like one of them is that all the families that we serve we encourage to have a medical home. Right. So that is a place that they can go to the pediatrician or whatever, and they can make that call and go directly there. Not use the emergency rooms unless they have to.
Yeah.
And we run between 99 and almost 100% of our families by the time they've been served with us have a medical home, can state who their pediatrician is or their doctor. That's huge.
That is. That's amazing.
It's huge.
That is amazing.
Another one is to make sure that babies don't get injured in their homes.
Safety.
Yeah, falling down a flight of steps. The horrors. I mean,
yes.
And it can happen in a flash, but helping families learn the prevention tools. Mm-hmm. So we have data around that. So it's just many things like that help us know that we are accomplishing our mission.
Yeah. I like talking about data, but then I like to crystallize things. And I think stories always help. Do you have a story of a family that you'd like to share to help people to understand the services kind of in a nutshell?
Yeah.
Family wanted spotlight?
Yeah, I have actually. I probably have two because they're short.
Okay.
One is we had a call from a grandmother, and there's quite a few grandparents who are parenting.
Yes.
In our community, and they gave us essentially an SOS call, and they had just found out that they needed to go pick up a baby that was a relative of theirs. They were in their 50s, and they were about to retire.
Wow.
And planning it, and it turns out it was triplets.
Oh my God.
And so it was triplets. They were triplets, and they were all three in the intensive care nursery out of state. And they drove across, once the babies were released, went and got them and brought them home. And they had not had a baby in their home for 25 plus years, and absolutely panic stricken. One of the babies was still on oxygen. Another one, it was just a lot. And so we got involved, helped them get equipment, and help them. We have a couple of our staff who had multiples themselves, had twins. And so just kind of the field management of having three babies in the house. And then in the course of doing medical screenings with these babies, we were in the house every week for a while. And then every other week, one of the babies had the nurse noticed that there was something going on with their eye. and she insisted that it get looked at, and it turned out the baby had a cancerous piece behind their eye, a lesion of some kind. And so just being there to pick those kinds of things up. The other quick little tale is about moms, and maternal mortality is a growing concern, both nationwide, but here too.
Right.
We shouldn't be losing moms during delivery and the postpartum period. We should not. And so we have this, actually not too long ago, we had a nurse go in, take mom's blood pressure, and say, this is really, really high.
Yeah.
And she goes, actually, I've been having headaches, and I got a really bad headache right now. And they waited a little bit and did the part of the visit, and the nurse didn't like how mom was looking.
Right.
And tried the blood pressure again, and it was even higher. And she said, you need to go to the hospital.
Yeah.
And called an ambulance, sent mom to the hospital, and she didn't hear from her for a while, got kind of scared. The nurse did.
Yeah.
Come to find out, she was in the ICU.
Oh.
That she had a condition that can happen in postpartum period,
Right.
and she was in the ICU. And the physicians told her that she is a very lucky woman because she would have lost her life had she waited even a few more hours.
Yes.
So being in the right place at the right time,
Yes.
and making sure that we've got our eye on mom,
Right.
too.
That could be a very different story.
Very different story, and a newborn without a mom.
Thank you to your team and, just for being there and being aware and acting quickly.
Yeah.
Acting quickly.
Yes.
So, Melinda, like I said, we could talk all day,
Yes.
but I think we're going to wrap things up now. And I just hope that people have learned a lot more about Nurses for Newborns and just, our partnership together. And as you heard, it goes back quite a number of years, and you and I go back quite a number of years. Let's just stay connected and focused on how we can continue to help people, especially our young people and our babies out there.
Right.
And moms, all families.
They're our future.
Right. They are our future. I would like to thank people for tuning in today and remind you again to follow us on social channels, YouTube, Facebook, and other ways that you catch your podcasts. Melinda, thank you so much for coming out today.
Thank you for having me.
Yeah. We'll see you soon. Thanks a lot.